Alright guys, so we get a lot of questions. How do you fix your low back pain? So a few things. There is no one way to fix low back pain, and it's really important that you work with a healthcare professional to make sure that your diagnosis is specific and individualized to what is going on with you. So that means work with a physical therapist, your doctor, or an orthopedic surgeon, or even a physiatrist to make sure that you have the proper diagnosis, and that's going to help you understand the best process moving forward. However, there are a few things that are kind of going to help you no matter what kind of back pain that you have. And a lot of the research shows that if we can get your glutes activated and we can loosen up some tight muscles, that you're going to have a little bit less back pain and be able to do some of the activities that you like around the house and also some sporting activities. So take a look at our how to assess your glutes, how to assess your hamstrings, and how to assess your hip flexors, and see if those are tight, and then you can try to address those with some of the videos that we have attached to that, and that will help you get started with addressing your low back pain. But here, we'll add a few exercises that are kind of our go-to for any lower extremity injury. You really shouldn't hurt yourself doing these if you don't know the origin of your low back pain. So give it a shot. Again, seek medical attention and get a really diagnostic understanding of what your low back pain is. So we put this right around our knees. We're gonna have our hips and our feet shoulder distance apart. So if you take two fists, put them in between your knees, and then put them in between your feet, that's about a good distance. We're gonna keep our toes up so we can push our heels down into the ground. Slide your hips down a little bit and then go ahead and lie on your back. We're gonna do what we call butt busters. We're doing 10 reps of everything. So what you're gonna do is push those hips up to the ceiling, squeeze through your butt. You wanna be at a neutral position here, straight as an angle. Pressing out a little bit into that band. Good. And then relax down. We're gonna do 10 reps of this, holding for 10 seconds on top for each one. And then after 10, what we're gonna do is pulse up and down for 10. We're coming down past neutral and then we're going up. After 10 of that, we're gonna stay up and then we're gonna pulse out for 10. And then you relax. That's only one set, so give yourself another try. Do one more round of everything. We're gonna do our clamshells now. We're gonna keep our resistance band here just for now, but we can always add it in a little bit later. The series that we're gonna do is gonna be pretty challenging for anybody and any athletic ability. So we're gonna lay on our side, and what I want you to do is put your hand underneath your head. We're gonna have our feet in line with our hips. So if I draw a straight line, and I lay myself against a wall, I'm in line right here. Now what we're gonna do is I'm gonna take my hand, I'm gonna put it right on the back side of my hip, and I'm gonna open up my knee. I'm using my glutes. I'm gonna do 10 of these. After 10, I'm gonna hold this leg up for 10 seconds. After 10 seconds, I'm gonna pulse it open for 10. The whole time, I'm feeling in my butt, trying to make sure that I'm using the back side of my butt muscles and not my hip flexors or my TFL. After you do this, try it on the other side. Go for 2 reps, or 2 sets, and if that's still easy, go ahead and use your TheraBand. So we're gonna add in a little bit of our core here. We're gonna do alternating upper extremity and lower extremity, or what we call a bird dog. I like to call this my superhero pose, because I want you to think that one arm is getting pulled forward like Superman, and then the other one is going back on the opposite side, okay? We're looking for elongation this way as opposed to up to the ceiling, and you'll see what I'm talking about. So we're gonna go in our hands and knees position. If you don't have great knees, go ahead and grab another mat or fold this over. All right, so go ahead and go on your hands and knees. We're gonna make sure that our shoulders are over our elbows and over our wrists. If we start to lean backwards, we're gonna put a lot more pressure onto our wrists than we want, okay? So really make sure that everything is stacked. And then we also wanna think about scapular stabilization. So we do not want to be in this winging position. You guys see my wings, okay? We actually wanna push up and away from the ground. This is what we call a serratus press. so that my shoulders are stabilized. My scapula is stabilized, okay? So in this position, my hips and knees are shoulder distance apart. And then, first thing, go ahead and just test out your balance. Bring one arm forward, and then bring it back down. Bring the other arm forward, bring it back down. We're gonna try this with our legs now. Kick it back, good, and then kick it back. As you can see with my leg, I'm kicking it back and pointing to the wall behind me. I am not raising my leg up to the ceiling, okay? So, every time when you come back to neutral, I want you to try to get your hands in the same position on your mat as before. So we'll go alternating now. Right arm, left leg. Again, think like I'm being pulled apart like tug of war. Pull in through your belly. You should feel it on your obliques as well through your entire core and belly. Hold for 1 to 2 seconds, and then switch, and then alternate again. Make sure you pair this with your breathing. One thing we don't want is arching through that back. We are not raising to the ceiling. We're getting pulled apart. You're gonna notice the difference here in your core when you get pulled apart versus extending up to the ceiling. You can see here, I'm activating through my glute, and I'm making sure that my glute is firing more than my hamstring. If I start to raise up, I'm gonna arch through my low back. That's not gonna be good. My core gets inhibited, and that's not the point of this exercise, all right? So again, right and left is 1, 10 on each side. Good, so what we're gonna do is pull in through the belly button. We're gonna bring one knee up to 90 degrees, and then back down, and then the other knee to 90 degrees, and back down. What we don't want is the knee to be bent and the hip to come up too high. So what we want is a nice good bend at the 90 degrees, and then our knee is at 90 degrees, and then we drop it down. We're gonna maintain our knees in neutral. So we're gonna keep both of these knees pointing upwards. We don't want it to come up and across our body. So when we come up, we're going straight up to the ceiling, back down, up, straight up to the ceiling, and back down. Good. Keep that core engaged, relax the rib cage, make sure that you're breathing, and we always say that this is nice and tight around your belt line or your belly button. Right and left is 1. We're gonna do 10 on each side. Our next stretch is Piriformis Stretch. So what we're gonna do, our knees are gonna be bent, our hands are gonna be behind us. We're gonna take one leg, put it on top of our other knee, and then we're gonna bend as tolerated. You're gonna feel this stretch in the back side of your hip, a little bit into that hamstring as well. You can hold this for 60 seconds. If it's too uncomfortable, you can walk your hands back, or you can straighten out this leg a little bit. So you can kind of tease yourself between both of this. Maybe I push myself higher and I keep my back nice and straight, my chest is out, and then if that starts to get pretty easy, I walk my heel back in, and that's gonna get the stretch to be a little bit more intense on that left outside. So hold this for 60 seconds, and then go ahead and switch sides and see how you feel. Okay, now we're gonna do what we call our prone quadricep stretch. So we're using a strap here on our foot, and then we're gonna use the strap to pull our knee into knee flexion, and we're gonna hold this. It's gonna be a static stretch, 30 to 60 seconds. We've put our knee up on a foam roll to get ourselves a little bit more hip extension, and then that's gonna help us stretch rectus femoris, which is the front part of that quadricep muscle. It comes up and it attaches just above the hip, So putting yourself up into hip extension using a foam roller or a pillow is gonna give you a little bit better of a stretch through the hip as well as the knee. So go ahead and hold this 30 to 60 seconds, twice on each side. All right guys, so what we're gonna do now is what's called supine twist. So we're gonna have our knees bent, we're gonna cross one leg over the other, our arms are gonna go out to a T, and our legs are gonna fall opposite of the leg on top. So lay on back, legs go to the right, and we're gonna look to the left. We're gonna hold this stretch for 60 seconds and give it a nice good breathing exercise and breathe in and out. On the breath out, really let your legs fall down to the ground and you'll get a nice good twist and stretch on this left low back. Good, and then rotate to the other side. And let the legs fall to the left, head goes to the right. One side might be tighter than the other, and that's okay. Really make sure that these hips are stacked on top of each other and breathe into this with each big deep breath. Let those knees fall to the ground.